Yeah, so my presentation with St. John's Episcopal Hospital is called SARS-CoV-2 infection, uncovering latent Mycobacterium Leprae infection. So overall, a 46-year-old Hispanic African-American male presented with a COVID infection and co-infection of leprosy. He did admit to stress, and there was a 3mm punch biopsy performed on the plaque of the left upper cheek. The biopsy was reported with obviously the leprosy and innumerable beaded or fragmented organisms. The biopsy was then taken for an H&E stain and revealed mononuclear histiocytes and numerous admixed lymphocytes. As you can see, his leprosy was pretty severe for his facial features. Yeah, there you go. And there are two overall theories. The first theory is that if you have COVID, it can basically trigger a reaction of the leprosy infection. And that includes the type 1 leprosy that with multiple cytokines, and type 2 leprosy with dermal neutrophil infiltrate, as seen here. And this leads to skin disfiguration. And then on the other hand, the second theory that was discussed was that the leprosy causes a downgrade in immunology, causing basically opportunities for the type 1 leprosy to develop. He was treated with prednisone and specifics. Overall, he was treated with clomiphene or clofazimine 50 milligrams daily and rifampin 600 daily, and was sent for GDP6 deficiency testing before starting the dapsone 100 milligram daily. This could be theorized that put him at an increased risk to develop a further expanse for COVID, but we're still testing these two immunology interactions. Overall, leprosy formed a type 4 hypersensitivity reaction that had to do with Th1 cell 1, 3, and 5 immune responses. And they're basically overalls, back and forth between if leprosy triggers the stress and infection, or if COVID does that, and vice versa because of this co-infection. And considering these two theories proposed, our unique case suggests that COVID-19 may induce or exacerbate leprosy reactions. For example, he did admit to being stressed, but he also developed this autoimmune disease. Leprosy reactions may lead to disfiguring complications and social isolation in a vulnerable patient population. Therefore, early diagnosis and treatment is necessary to minimize detrimental complications such as the facial disfigurements in here. Throughout the pandemic, dermatologists must increase their index of suspicion for uncommon cases due to the possibility of COVID-19 triggers. An interesting question that we added in here was, what is an immunologic theory behind why SARS-CoV-2 can trigger type 2 leprosy? I can skip to the answer, but basically it's because of the neutrophil infiltrate as seen as the biopsies, the 3mm punch biopsy here. Yeah, thank you guys so much. And I'm open for any questions.
Thank you, Isabella. Do you know if COVID infection can also lead to uncovering of other Mycobacterium species, such as Mycobacterium tuberculosis?
Yeah, absolutely. I do. Well, it's not known for sure, but the overall encompassing issue would be that it decreases your immune system, similar to the way HIV might decrease your immune system and put you at risk for opportunistic infections. So I definitely think that tuberculosis could be a factor, but there would have to be a lot of research. And as you know, COVID is an up and coming research topic. Thank you guys. Any other questions?
Okay, thank you, Isabella.